HMPV virus infection in children. Are you prepared? In this video, we will talk about what is human metapneumovirus, HMPV? Human metapneumovirus, HMPV, is a single-stranded RNA virus from the Paramyxoviridae family, which often causes upper respiratory infections and, in some cases, elevates lower respiratory infections. Most individuals get HMPV infection before the age of 5, and the infections are commonly observed in the spring and winter seasons. Children experiencing the HMPV infection the first time are more likely to develop severity than those getting it again, as the body builds immunity after the first infection. How severe is human metapneumovirus? While most cases are mild, about 5 to 16% of children can develop lower respiratory infections like pneumonia or bronchiolitis. Who is at risk of getting an HMPV infection? Hope this content has been helpful for you till now. Don't forget to subscribe and hit the bell icon for more such child health and care videos. Continue watching. HMPV infection affects both children and adults, but is commonly seen in premature infants and children below the age of 5. Is human metapneumovirus contagious? Yes, HMPV is highly contagious. It transmits by coming in contact with respiratory droplets of the infected person or touching surfaces contaminated with the virus. HMPV symptoms: cough, runny or stuffy nose, cold, fever, sore throat, rash, shortness of breath, dyspnea, wheezing. Fever and runny nose usually begin 3 to 5 days after contracting HMPV infection. How long does it take to recover from human metapneumovirus? Mild HMPV infections take about 3 days to a week to recover. If the infection is slightly severe, recovering may take a little longer. Symptoms like cough may linger for some time. Can you get HMPV infection more than once? It is possible to get HMPV infection twice or more than once. In subsequent infections, the severity reduces, and the infection gets milder as the body builds immunity to it. What are the complications of human metapneumovirus? While most HMPV infections are usually mild, children may progress to more serious conditions, such as pneumonia, bronchitis, bronchiolitis, acute respiratory distress syndrome, ARDS, ear infection, otitis media. Treatment for HMPV infection. There is no specific antiviral medication to treat HMPV infection. Doctors recommend symptomatic care to manage the symptoms. Over-the-counter OTC medications, decongestants, inhaler for wheezing and coughing. How to protect your child from HMPV. Ensure your child thoroughly washes their hands with soap and water. Keep their vaccination up to date. Have them wear a face mask when outside. Avoid crowded places. Encourage them to share food but eat in separate utensils. Teach them to avoid touching their face, mouth, nose, or eyes with unclean hands. When should you consult a doctor? If the symptoms worsen or your child develops the following conditions, seek immediate medical attention: high fever, shortness of breath, wheezing, severe cough, bluish skin, lips or nails. Please note that HMPV infection and COVID-19 are not the same. Consult your pediatrician when you see the HMPV symptoms in your child to prevent its progress.